Hello, my name is Maureen Sintich, Senior Vice President and Chief Nursing Officer of Hackensack Meridian Health. Here with me today is Dr. Marty Scott, Senior Vice President and Co-Chief Quality Officer of Hackensack Meridian Health. We'd like to welcome you to another episode of Starbucks with Sintich, where we'll be discussing the important role of bedside shift report and whiteboards in a high reliability organization, or HRO.
Thanks, Maureen. It's great to be back for another episode of Starbucks with Sintich. I may need a spinoff. I think my people will be talking to your people about that. It's true, whiteboards serve as an important tool. They keep us all on the same page and keep our patients and their loved ones informed. And we are asking for your commitment to update and use the whiteboards as you talk with your patients at every change of shift.
We are introducing new whiteboards that have been co-designed by nurses, patients, and doctors. The components of each board have been carefully reviewed with the groups we just mentioned and prioritizing what's truly important to capture. These new boards will be introduced in all inpatient and emergency care settings.
And while we understand you're there taking care of patients and busy, it is definitely not something to be skipped over or rushed through. Oftentimes, patients depend on their whiteboard to understand who is taking care of them, while we as a team depend on whiteboards to see things that matter most to the patient. In a co-design session with patients, they told us the whiteboard's like a report card that influences their perception of care when filled out consistently. They feel like we know them better, and they feel as though they better understand their care, ultimately feeling more secure. When not properly used, they feel as though that we are not in sync on their care, and they often struggle to remember their care providers' names.
As you know, these boards are updated at every bedside shift report. Most items do not require much time and often let the care provider know how the patient is feeling that day or what matters most to them. We're asking for your commitment to ask the patient what matters most to them at each shift change. As you know, it can change from morning to evening. Asking what matters most helps us understand the patient on an emotional level and how to best proceed with their care. It's also creating a caring conversation, opening up meaningful two-way dialogue.
Patients become more engaged and appreciative, and these whiteboards make handoffs easier during shift changes.
We hope this program has inspired you to hardwire the use of your patients' whiteboards. They are truly invaluable and help us to achieve the best experience every time for our patients. We hope to see you back for another episode. And as always, thank you for helping each other help our patients. Bye-bye.